use that. It's there. It's in your bed. You don't have to wait for a nurse to unlock the cabinet or anything like that. So don't hesitate to use that. The second line of defense is the most powerful, and that's an intravenous injection of narcotics that the nurse has already ordered for you. You just have to say, I'm in pain and I want that pain medicine Dr. Rutledge has ordered. It's called Dilaudid. It works very well, and it's available to you at any time. It has a it has a side effect of actually causing euphoria, so it is a positive experience. Don't hesitate to use it. You won't get any more after the first day, so you can have pain the first day, so don't hesitate to ask for the nurses for that. The next thing is that, besides that, you also have tablets of oxycodone, and that's basically a very powerful oral pain medicine that you can use as well. So we've got you covered on pain. We have had experiences that are very disconcerting and disappointing to me, where I had a lady sitting actually right in that chair, and so we're going around on the morning after surgery, and I said, how's your surgery? And she said, oh, it was terrible. And I said, really? What's wrong? She said, I had a lot of pain. I said, oh, well, did you try the pain medicine? She goes, no. But see, the pain medicine is if you have pain. So a lot of us have the kind of tough John Wayne, it's only a flesh wound, doc, send me in, coach, kind of, and we don't want you to do that. Studies show that groups of patients who take the pain medicine can breathe deeper, walk more, and have fewer complications. So we want you to have the pain medicine. Don't hesitate to use it. And you're going to make me look bad if you come down here tomorrow and you're in a lot of pain, when all you had to do was ask the nurses for the pain medicine. So there's pain medicine there. There's the pump that you can use. We've had some people say, no, I didn't want to be a baby and use the pain pump. And we're going, it's not being a baby. It's just taking away that pain. And remember, here's the way to think about it. Today, a masked man is going to sneak up on you when you're defenseless, stab you in the belly 5 times, crush your stomach, staple it, and sew on it. Push the button a little, So that's the pain medicine story. In addition, you might have some nausea. Another word for nausea is upset stomach, and it's hard to envision a more upset stomach than one that's just been crushed and stapled and sewed on. So there is, again, nausea medicine, but you have to ask the nurses. And there are 2 kinds, and they're available if you need it. As soon as you get upstairs and you start to wake up, when you feel like it, you're allowed to start eating and drinking. Sometimes the nurses will bring you medicines to take, and we've again had over-conscientious patients kind of get confused. If they bring you a bottle with 400 pills in it, do you think you should take them all at once? Thank you.
Just want to show you that.
Oh, 203?
Mm-hmm. All right.
So your sugar's not too bad.
I considered that not too good.
Oh, well, you haven't worked here.
Oh.
No, that's diabetes, but it's not bad. So if you get a nurse, a nice nurse brings you in lots of tablets and pills, remember you just had surgery, and that nice new narrow stomach has been stapled and sewn on. So when you get your first tablets, don't do this and then start drinking. The guidelines are very slow if you're eating something very well chewed and very small amounts. So if you get a little stack of pills, your Pepto-Bismol and Tums and stuff like that, just hold off, take one at a time, and just wait. None of the medicines that you are asked to take today in the hospital or afterwards are critical. If you don't feel like it, let the nurse know and just refuse, and they'll call me and we'll discuss what to do. In general, we'll just say, skip it. Don't force anything. If you don't feel like it, you don't take it. Because we've had people say, oh, I'm really nauseated. I said, really? I heard from the nurses you were doing okay. I know, but I took those 7 pills. And then they brought dinner, and I had a cup of soup, and I had 4 crackers, and I drank a bottle of Gatorade, and I'm really feeling bad, So that's too much. As far as walking and getting out of bed, Don't try and walk and get out of bed if you're woozy. This kind of seems to me kind of obvious, but let me say it again. If you're feeling weak and dizzy, do you think you should be up walking around on a hard concrete floor? No, don't do it. Now, is it advantageous to get up and walk around as far as protection against blood clots in your legs? Yes. So we do want you to walk around, but you're trading off falling on your nose against protecting against blood clots. So wait until you're wide awake until you decide to tour the hospital. Okay? Now, let's suppose you have a concern about blood clots, and that's one of the things we could talk about later. If you're concerned about blood clots and you're not up walking, sloshing the blood around, there's some things you can do in bed. Like right now, I'm going to ask everybody to take your feet and put them out in front of you and hold them up straight. Okay? And then I want you to pull your toes back towards you until you actually feel your calves hurt. Stretch them and out. It should hurt. Actually pull hard and make it hurt. Now what we've done there is we've actually stretched the endothelial lining of the blood vessels and released tissue plasminogen activator, or TPA. TPA is the clot buster that we inject into heart attack victims over here in the ER. That was about $5,000 worth of TPA there. And I'm not going to charge you more than $500 to support it. So let's do it one more time. And when you release that clot buster, that helps protect you against clots. So if you don't feel like walking and you're tense about blood clots, you can stretch. You can, while you're in bed, you can just pull your knees up and move around a little bit. Even, you can do something as simple as this. You can kind of flex your forearm, and when you stretch that and flex your forearm, that also has been shown to release TPA. So, don't walk if you're woozy or dizzy. When you do feel good, do get up and walk around because that's good for you. Another interesting and kind of surprising thing to me is the studies that have found that you're going to feel better and have less pain the more you walk. So if you wake up with some pain or discomfort, you might say, oh, I'm not getting out of bed because this hurts. And that's okay. Don't hesitate to stay in bed and rest and have some pain medicine. But surprisingly, our patients tell us over and over again that when they get up and stir around, it often starts to make them feel better. So it is something that when you feel like it, we'd encourage you to kind of get up and stir around because it kind of stretches out, gets the kinks out, and makes you start to feel better. So again, you have surgery, you'll go upstairs, you'll be on the 4th floor. As you are later in the day, you're going to see the patients who went ahead of you, and you'll bump into them as they walk around. The family, you'll see one another there, and there's a waiting room you can you'll see one another. Some of you may actually be in the same room with one of the other folks who's having surgery today, and so that's often fun to kind of get through the night. We will then expect you to basically do usual stuff during the night. That is, sleep if you feel like it, walk, have a little sip of something to drink until tomorrow. And tomorrow around this time, we'll come upstairs, and if you feel like it, we'll drag you down here to talk to everybody. And then tomorrow, you'll do the same, more of the same, walking and taking some liquids and having some crackers and having a bite of yogurt, very slowly, not forcing anything. And tomorrow afternoon, you're off to the hotel or back home.